The advice and opinions expressed by Dr. 𝗟𝗓𝗧 and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen 𝗟𝗓𝗧'𝗦 is the
Dr. Doreen is an expert in autism.
Doreen 𝗟𝗓𝗧'𝗦.
Dr. 𝗟𝗓𝗧'𝗦.
Dr. Doreen 𝗟𝗓𝗧'𝗦.
Dr. Doreen 𝗟𝗓𝗧'𝗦 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Our first question was, I have a question for Dr. Doreen. We've started ABA services and we chose center-based because my husband and I both work. We're a little surprised at how much we're being asked to come to the center for training and other things. I don't mind it because my job is flexible, but my husband's job really isn't. He thought this would be like school. We drop our son off and pick him up, and every once in a while parents are invited to see a presentation. But we aren't at a school ever asked to learn how to teach the lesson to our child.
Right.
My husband feels very pressured and feels like the team is judging him when he can't attend. He's pressuring me to stop ABA and just put our son in preschool. This is a very familiar tale that I hear from people. I feel pressured on both ends, but I believe that ABA is going to help our son, and I want to do whatever I need to do. What is the role of family? Is it normal that we're being asked to do and learn so much? Great question.
Great question, and I'm actually really proud of whoever your ABA provider is because they're doing the right thing.
Yes.
So I guess I'll start by just talking about how ABA is different from school. You know, you go to school and essentially, yeah, there's of course a skill to being a teacher, right? But nevertheless, you are speaking English as a teacher, and you are just doing it as a normal course of life. ABA is not that. You cannot just step into ABA. You must learn ABA. It's like a different language. It's a different way of communicating. It's not really about, I mean, it's a very different way of communicating. I don't know how to explain that. It's kind of like learning a new language.
Yeah.
So therefore, it becomes vital for you as parents to learn how to use ABA on a day-to-day basis. Your child might be at the center, I don't know, for anywhere between 10 hours a week to 30, 40 hours a week, I don't know. But the rest of their awake hours, you and everyone in the child's life need to be communicating in the same way. And I'll give you some examples of that. So for example, let's say your child is, I'll give you two examples. First, I'll give you an example of challenging behavior. So let's say your child has tantrums, and the ABA team is trying to teach your child not to tantrum, but to communicate otherwise. Because remember, from a behavioral perspective, all challenging behaviors are a form of communication. The child's trying to say something. Usually when it's a tantrum, they're trying to say, I don't want something that you're trying to impose on them, or I want something that they don't have access to, right? So in ABA, what they will do is they will not give that item, object, activity, whatever it is, if the child tantrums. Instead, they will prompt and teach the child to communicate in a different way, and then they'll give the item, okay? And that way your child learns, oh, the tantrum is not really effective, communicating is effective. Now your child comes home or wakes up in the morning, whatever times that they're not at the center, and they tantrum. What do you do? If you don't know what to do, it's likely that you'll just give the child that object that they're tantruming for. That's how we usually are with our kids. And then your child will be very confused. They'll be like, hold on a second, when I tantrum here, I'll get the objects. When I tantrum there, I don't get the objects. So which one is it? What's the rule that governs behavior? What am I supposed to do here? Mm-hmm. So that doesn't just mess things up for you at home. In fact, it severely causes problems at home because there's a thing called behavioral contrast. Child will start increasing their challenging behaviors at home and really decreasing them at school, at the center. But that's not the only issue. The issue is your child gets confused. They don't know the rules, so it'll take a lot longer for that challenging behavior to decrease. Okay, so it's because They're speaking a certain language that they've now learned and you're not there yet. That's an example of a challenging behavior situation. And there's many of those, right? I mean, you need to know exactly what to do if your child's tantruming in a mall, at a restaurant. What if your child runs away? How do you deal with that? What if your child spits at you or bites? What do you do? There's all these different scenarios in life, and you need to be trained because a behavior therapist or a BCBA is not with you at those times. Now, let's look at another scenario, which is skill learning. So let's say, for instance, your child is now learning language through their ABA, and they have been taught at the center or are being taught to request things in 3-word phrases like, I want milk, I want juice, whatever it is. But you're not trained, and they come home, and at home, all they have to do is take you by the hand and put your hand on the object, and that's how you used to communicate, so you'll give them the object. That will, again, slow down your child's acquisition, your child's learning, because now the child's thinking, well, which one is the rule? Am I supposed to use 3 words, or do I just take someone by the hand? So this consistency that I'm talking about is so vital that if you don't have it, it's going to really, really mess up your program and really, really delay things for your child. That's why it's important to be trained. Now, the training doesn't have to be intensive and forever, right? Like everyone can learn the basic techniques within, let's say, a full week. So I think what your husband might want to do, which might be more interesting to him, is he might want to literally infuse it, like take a week off if he can, and infuse himself in the training, both online and with the team at the center, and that might help him really understand ABA a little bit better. And then from there on, he would maybe have, like, you know, once a week or once every 2 weeks, an hour call or meeting with the supervisor. It's not going to go on forever. But the more you infuse yourself, the more this is going to help your child. That being said, I know that there's going to be a lot of parents listening to this thinking, I just can't do it. Like, I just can't do it. I'm overwhelmed already. I really need support and help. I cannot get involved with this. And that's fine too. It's just that you need to have an open conversation. Please do not stop your ABA. Have an open conversation with your supervisor, the BCBA in charge of your child's program. Maybe they can make some accommodations. Maybe they can come to the house. Maybe they can put signs up everywhere. Maybe they can give your husband and you very short lessons in things to do. It doesn't have to necessarily be at the office, at the clinic. They can also try to do some of this stuff on Zoom. A lot of the theoretical basis of it that I'm talking about right now, they can certainly provide to you via Zoom, for instance, so that you just start to become familiar. But it is important. It contributes to the well-being of your child.
Absolutely. And can I just say from the emotional side, how normal this is?
Yeah.
How normal that you're surprised, how normal that your husband is saying, this isn't working for us, let's do something else. This is so common. Yeah. But I hope that you won't let that be the status quo and that you won't allow yourself to feel pressured, that you will acknowledge that part of it is that your husband is feeling powerless, like I don't know what to do. What I remember is that I got very on board with ABA because I'd seen a kiddo who is doing amazingly and that we have to say is going to be playing at a very important concert happening on September 9th. He's going to be playing the drums for Toto. This is a kiddo that I met when he was 4 in the middle of therapy, and now he's a professional drummer playing at an event that Ringo Starr is playing at that benefits the 𝗟𝗃𝗧 Center.
I know, I love this so much, I can't even tell you.
But I saw this kiddo when he was 4, and he was my inspiration to come and meet you and to start doing ABA. And I got all on board, and my husband, my husband is amazing, and he said, that's great, let's do that. But then once we started doing it, he was like, yours. I don't have, you do it, And I will say that for a period of time, I didn't really know what I was doing either, and I was having that, I don't get it, and why can the BTs that come in do things with him and I can't do it? And then about 4 months in, a day came where my husband would come home from work and the therapists would be there. We called them therapists back then, technicians now. But one of them said to my son, said his name and said, "Come here." And my son came over and they did something and happily played together, and then they left. And then I said, "Oh, Jem, come here. I want to show you something." And here he came, and he came to me. And my husband kind of watched this. And so he said, "Jem, come here," and Jem did not come to him. And he tried this for like 5 days. And I wasn't really tuned into that because I was on so many other planets at the time. And then finally my husband came to me in tears and said, "I don't get it. What am I doing wrong? When you call him, when Peter calls him, when Dominique calls him, he comes to them. Why is he not coming for me?" And it was not my best moment. It was not my grace moment, but I said, "Well, you better learn this stuff because otherwise we're going to leave you behind." I said, "You better get with it and start paying attention and learn what they do." And so he did. And after that, I heard Holly Robinson Peete tell almost the same story. That she went to Rodney and said, "Hey, pal, I'm on Autism Avenue, and you either get here with me and learn what this is, or we will leave you behind." I don't know that that's the best technique, but it's what we went through. But I know that even if your husband won't do it right now, you do it, and eventually he'll want to do it too. But push, prod, cajole, bargain, whatever, to get the husbands involved. Because I will tell you a secret, when the husbands understand it, they get real good and zealous.
I think I totally agree with all of that. And I always, this is the analyst in me, you know? And I always
say the better way.
No, I just always think, why do the dads sometimes have a hard time coming on board? And it's a lot of different reasons, and I feel like you gotta kind of see their perspective as usual and try to understand where they're coming from as well. I mean, there's a group of dads that are just kind of like, they grew up with the thinking that the child and everything having to do with the child is your issue. I go to work. That's the older thinking, right? And that they're like, "I've learned everything I need to learn. I don't need to do more now. I'm tired when I come home." This is not that we're not tired, we are, but somebody needs to pick up the ball, right? There's a group of dads that don't want to fail, so failing is a big deal for them, and they're thinking, "I'm going to fail at this, so I'd rather not even try it." There's a group of dads that are so devastated from giving up the vision and dream that they had for their child that they're frozen. So, every person has a different thing that's causing them to not interact, not engage, and I promise you, this is one of the things I love about, I'm a Middle Eastern woman that grew up in the States, and this is one of the things I love about American women, is that there's this expectation in America that everything is shared, and that's really a beautiful thing, which doesn't really exist in all other countries yet. But it's up to you as mom, I guess, to make sure that dad understands that he's got to be part of the team. In one way or another, because this is not easy. I mean, my hat off to, there are a lot of single moms that I know whose children have recovered, and they're just spectacular human beings. But this is not easy. You need a village, and dad is part of that village, a very important part of that village.
Absolutely. There is a dad's online support group now. You know the gentleman that do the my two dads, just two dads. That's what it is, not my just two dads. They do podcasts. They were part of our podcast-a-thon, and they have a dad support group too.
I love that.
Where special needs dads talk to each other.
Perfect.
So, something that if you want to tell your husband about, because I think that they need a community to talk about with as well.
Definitely.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.